Nature has made man and women, boys and girls, all equal, and then this topic on male infertile. What do you say, Manish bhai?
Nalini Ben, when you say Manish Bhai, word itself make me infertile.
I do agree maybe that it is less common than female infertility, maybe at times, or maybe whatever reasons, but I don't agree with you that it doesn't exist. It does exist.
Madam, if you say male and if you say female, male is only male, but he has got male. That is FE-MALE. Without male, female is incomplete. God has given male first, Adam is first, then he made Eve. After the making of Eve, never males left, never gods left. So don't say that madam male is not infertile.
તમને વાતોમાં નહીં જીતી શકાય કદાચ પણ I still don't agree this is true. What do you have to say about age-related infertility? Somebody who was fertile earlier, maybe increasing, advancing age, might become infertile. And the couple may face problems in conception.
Madam, God has given ovum and testes together, that is SRYG, it decides that ovary is descending and testes is also descending. God has given fixed number of ovaries, but there is no fixed number of sperms. Male can produce sperm at any age. There is menopause, there is nothing like andropause. Age may decline the sperm quantity and numbers, but you can't say that male become infertile at the age of 78. They can produce. You can see there are males who have got 103 children with them, with 16 different wives.
First of all, there definitely is a term called andropause.
Yeah.
And okay, what do you have to say if the man produces an adequate number of sperms, but there is some difference in the quality? I mean, the concept of quality is there everywhere, and hence we also need to consider that as well.
Madam, if you see about the sperm quality, WHO has given different notion for sperm parameters since 2000 to 2024. Different sperm parameters are there. Now they said only 4% normal can give you fertility, number one. Number two, if you talk about the semen sample, even in the morning and evening semen sample may be different. Punit, you are agree or not? Patient has given sample in the morning and same sample in the evening, or sample after few days or sample after 7 days. So male are always male. They behave differently, but I don't agree that they don't have sperm inside the ejaculate.
Okay. What do you have to say about infections? Maybe sexually transmitted infections or other chronic infections with increase in sexual promiscuity these days with the live-in relationships and so many concepts, newer concepts these days. So there is a steep rise in sexually transmitted infections. What do you have to say their effect upon infertility? Male infertility.
Madam, particularly it's upon on injunction that whether should I expose myself to that promiscuity or not. This year we have got Ashray in Amsterdam. So many people are asking me whether you are coming to Amsterdam or not. This time there will be maximum number of participants in the Amsterdam. Why? Because this is the only country where everything you say is free. But that is upon the himself that whether you should apply yourself into this promiscuity or not. If you want to go for it, you have to suffer for infertility, you have to suffer for low sperm count. So we have to protect ourselves, and if our patient has got this STD, you have got different modalities to cure that STD. Because STD and ISD are coming from just like PCO, public calling booth. Then it comes sexually transmitted disease and something like HIV coming from international substance called ISD. So we have to protect ourselves if we want to preserve our fertility. You don't go with the word of PCO, public calling booth. Come.
What do you have to say about the chronic illnesses, some kidney diseases, some other chronic illnesses a male can suffer from?
Yes, madam, you forget the diabetes. So diabetes, hypertension, chronic kidney diseases, they can all affect fertility, but this disease not come from the infancy. You can say there are so many diseases which come with adult disease of childhood origin, but diabetes doesn't come at the age of reproductivity. But if you suffering from diabetes, if you are suffering from hypertension, if you know that I have got chronic kidney diseases, there is all facility to preserve your sperm with the IVF specialists like us. They can preserve their sperm samples for years together.
What do you have to say about the hormonal imbalance? FSH, LH?
That FSH high is always coming when the patient has got azoospermia. If there is locally high FSH and there is obstructive azoospermia, you can cure it with testicular or vasovasoepididymosis, or you can take the sperm from epididymis. You can have a TESA, MESA, and if you know about the TESA, MESA, there is very good PESA.
What do you have to say about the medications of the disease you just now mentioned? And some other medications like some chemotherapy, some steroids, they also have a lot of effect upon sperm production as well as the quality.
Whenever any patient comes to me for infertility, particularly with low sperm count or erectile dysfunction, I remember the God issue. Give thou ears, listen them carefully. Take the history. What is the definition of history? A study of past in light of presence to have good future. If you ask that which medication they are taking, atenolol, simple medication. How many of you know that atenolol causes erectile dysfunction? Simple medicine. So you have to give them ears, listen them carefully, and give the drug which cannot hamper their fertile potential, which cannot hamper their impotency, we cannot give them erectile dysfunction. Discontinue the medicine and continue the medicine which is not affecting the infertility.
Okay, so now what argument do you have against having excessive heat affecting the sperm quality and function?
Yes, madam, heat is nowadays within their lab, because everybody is using laptop. It produces heat and it can cause damage to the testes. Because why God has given testes outside to the body in humans? Biggest mammal on earth, you know? Elephant. But you see, elephant doesn't have testes outside. Elephant has got testes inside. Because elephant is usually living in the tropicals where there is very high temperature. So you have to protect your testes from temperature. So laptop should not be on the lap, it should be on the top. And if you want to use it, use with fan. So it will cool your testes.
What about the well-known condition varicose, characterized by swollen veins in the scrotum?
Varicose vein has got different ratings, 0, 1, 2 and 3. I remember the name Pamela Anderson. Because usually we remember, males are usually remember the name with some good female prepotence. Pamela operations are there. They can ligate the family complexes, they can ligate the vessels, they can increase the sperm count, and it is not possible. Punit is there, or Gohil is there, they can take the sperm from epididymis and they can give fertility.
You just mentioned about elephant having the testes in the body. What about undescended testes in human being? What are we going to do? They definitely are going to suffer from infertility.
Definitely, madam, when there is undescended testes, they are not suffering from the infertility, where they are also suffering from the male prepotence. So if it is diagnosed early, we can make descended testes from the undescended to the testes in its proper place. But if it remains too long into the body, that testis is no testis. It doesn't give any hormones, it doesn't give sperm.
What about some unfortunate people who have some malignancies? It's on a rise due to maybe increase to the life expectancy or maybe better diagnostic tools. What about them? We cannot tell them just because you have malignancy you cannot have children.
Madam, malignancy, chemotherapeutics, radiotherapeutics, it doesn't come overnight. Patient know that they are suffering from this, patient know that they have to take chemotherapy. And now we have got too many specialists, those who are doing fertility preservation surgery, fertilization preservation with sperm preservation. Even if you see nowadays with malignancy of uterus, we can put that ovary right up to the abdomen. We pull that ovary and we can give radiotherapy. So there are so many fertility preservations are there. And when male is subjected to this type of chemotherapeutics and radiotherapeutics, they can preserve their sample.
And what about nutritional deficiencies?
That we have to take good nutritional food.
And what about obesity?
Obesity is nowadays increasing, but if you control your body weight and if there is too much obesity there are always helpful bariatric surgeons are there. And those obese patients, they can afford bariatric surgery, they can go for it. And usually this type of obese patients are coming there. First question I am asking whether it is possible to do normal sex or not. So you can always take help of IUI and IVF in this type of patients because there are so many obstacles, there are so many bumps over there.
What about high levels of oxidative stress? Our life, everyone's life these days is very stressful, and oxidative stress, we all know, is known to cause an imbalance between antioxidants and free radicals, and it can definitely damage the sperm DNA and hence affect fertility.
Madam, today morning we have got very good presentation by Grace Amin on antioxidant. You know that our all foods, our all cabbage, our own your green, what you call madam? Green swallow, broccoli, cabbage, these all are with very high antioxidants. So if you have to go for stress, first and forget you remove stress by yoga and meditation. Take good healthy food, good nutritional food, and lots of antioxidants available with the pharma market. And from 30 rupees to 78 rupees antioxidant tablets are available. See the pocket of the patient and the right antioxidant tablets are there.
We have been seeing that so many of us, so many men, so many women both, but especially men are now on a rise with psychological upsets, some depression, some anxiety. What do we have to do about them?
Madam,
They
nowadays,
are definitely going to be infertile.
madam, that affects fertility potential. But nowadays, if you see in all high society, in all multi-speciality or multinational companies, they have got made slot for sleep adjustment, small naps, small meditation. You see the Google office? It has got swimming pool, it has got meditation, it has got massage chair. So you have to reduce your stress if you are in more stress. You cannot reduce stress by your own, but you have to find out the way. The way you find, I removed my stress buster is just reading. Somebody has got find out stress buster is music. Somebody has got found out talking with some good girls. So you have to find out which is really your stress material, and you have to reduce the stress.
What about smoking? What about alcohol use? What about marijuana? The availability of these, everything is on rise, and even the youngsters, the teenagers are very high on usage of all this. What about them?
Madam, smoking says, C, I smoke cigarette. SHEC, CEEC, and C. C, I smoke cigarette because that's why I'm great. Cigarette is the things, this is the only thing which we are taking. Suppose there is a cigarette packet in my hand. I offer you cigarette. You are taking or I am giving you. This is the only daan in which Lenara's heart is below and Lenara's heart is upper. Am I right? તમને વ્યસન કોક આપે છે તમે જાતે નથી લેતા કોને સિગરેટ દીધી
These explanation don't
so
explain.
we have this is upon us that we don't have to smoke the cigarette if you want to prevent our fertility, but smoking and alcohol really declining the fertility, we know that. But if you don't want to do, this is not a forceful thing, this is things we adopt. દારૂ પણ તમને કોક આપે છે તમે લેતા નથી, તમાકુ પણ તમને કોક આપે છે.
What about genetic abnormalities? Now don't say you have an answer to that as well.
Madam, genetic we can't say because it is coming from the God. You know, only Brahmins we have got genetic material since our beginning. You know our what is our nadi, what is our pravar. We cannot vary between our own guys like Rishi, Brahmarshi Rishi is there, Vishwamitra Rishi is there. So you have to protect your genetics, protect from conspicuous marriages, and genetic it is not a part of fertility. It is from the genetics it is coming. And if genetics is there, if it is infertile, then we can't have.
So maybe it is uncommon, but then whatever explanations you gave, I still don't believe that men are not infertile. The answers are what we can do for the reasons that they cause infertility, or maybe subfertility.
Madam, there is nothing like subfertility. Sub male are fertile. All male are not subfertile. Sub male are fertile.
I don't really agree.
Madam, nowadays we have got lots of experts. You give them the testes, they will find 1 or 2 sperm at least.
I don't agree with you.
Madam,
Otherwise,
you
we won't have these such discussions here.
Madam.
In the first place, we won't have such conferences in the first place, so we don't have that, enjoyment as well. But male are infertile, they are subfertile. Whatever your explanations might be, I don't agree. The treatments are available, but they are infertile.
Madam, एक स्पर्म ओवम का स्वभाव है।
How can
एक स्पर्म ओवम को एम्ब्रियो बनाता है। एक स्पर्म डिसाइड करता है कि whether it is male or female, even though sperm are very shy because they want SRYG that will promote that whether it is going for male or female. So एक ही sperm चाहिए मैडम। We are forgetting about the loss of sperm with all this capacity. एक sperm का सवाल है मैडम।
Whatever you might say, when nature has made men and women equal, you cannot just put the whole brunt of not being conceiving on the women, and especially you being a male gynecologist. I don't think you should think so. So just agree that yes, male are infertile.
Madam, male are fertile, that's why you are female. Because if you add male into the female, then it becomes female. Because of the fertility potential, male and female both are there. Male is infertile, then you see how much population is there. India is the largest country. You see the things made in Corona.
That
you
is-
think that what happens in Corona.
Listen, that is-
Even Kapil has got 2 kids in Corona.
I do agree that 1/6 of the world population is residing in India, but everything said and done, still it's a public issue. You know, the population is increasing. I don't say that it is a no, but there are so many infertile couples, and in spite of everything said and done, it's the male factor. I will not agree that male factor infertility does not exist. It
Right.
does exist, and it does exist.
Madam, male infertility exists. That's why so many IVF centers are there in all pan India. If you see in your Jamnagar, you have inspected so many centers within few days. Why is that? Because of male subfertility, low sperm count. But even though with IVF, male become fertile. Male are always fertile. Male has got fertility potential. Men give fertility at the home, sometimes at the outside, sometimes at the upstairs. Because so many times says, woman says, ऊपर वाला नहीं मेहरबानी है, मैंने फ्लैट में रहता है. Thank you very much. Our debate has ended.